Well, good morning, everyone. Welcome. Thank you for tuning into WHLI Health Talk this morning. I'm Dr. Victor Politi. I'm the president and CEO of New Health. That's Nassau University Medical Center, that big hospital on Hempstead Turnpike there in East Meadow. Well, as healthcare in America is changing, New Health is part of that change. So this half-hour program will provide you with some essential information about our services and facilities that provide a top quality of care that fits into your lifestyle. You already know Nassau University Medical Center as a premier level 1 trauma center. That's where the ambulances are. They're on Hempstead Turnpike. The helicopters are bringing in the patients from all over the county because we do provide that excellent level of care for Trauma 1. But we have so much more. We're a full-service, state-of-the-art hospital. We're a center of excellence. We have an A. Holly Patterson nursing home, and one of the prior shows, if you go online, you can hear about the nursing home, which is really an amazing story in and of itself, as well as our Long Island federally qualified health centers, which are family health centers that are located throughout Nassau. And again, we had one of the directors of their facilities here on the show as well. You can pick them up online also and hear about the health centers as well. But Nassau University Medical Center is such an amazing place. And it's not the old Meadowbrook Hospital that people remember. It's not the old county hospital that people remember. It's now separated from the county. It's a public benefit corporation with our own board of directors, with a new CEO, that's me. And we're actually looking to change the place and really make it a state-of-the-art facility. And over the last couple of years, we've been doing things like a brand new $38 million ER. We're building a brand new $24 million primary care center so that when you come to the hospital to see your doctor, it's in a private office type setting, really nice and really modern. Brand new ICUs and CCUs for critical patients. Our physical medicine and rehab upstairs for patients that have had stroke or car accidents or disabilities are really second to none and been rated by U.S. News and World Reports. Matter of fact, a lot of the hospitals in Nassau County send their patients to us for really intensive physical therapy, inpatient physical therapy, as well as outpatient therapy. So there are so many things, and I can go on and on and on. Not even to mention our women's care, our women's health services for mammographies. We have that new tomosynthesis machine that'll pick up very, very small breast lesions and can actually save a lot of women's lives. So we are a full-service hospital. We have so many things going on. You really owe it to yourself to take a look at the hospital. The floors are immaculately clean. You can comb your hair in them. The food is good. I eat there myself. So there's so many things that are going on to change that image, to make sure that people in Nassau County know that this is a real hospital, a real contender for their health care, and it's going to get a lot better even so. And I can go on and tell you about the new docs we brought on board, all board certified, top quality doctors from Harvard and Yale and Princeton, great places. But we have something here that's so important today, and that's emergency medicine. And yeah, I said we had a brand new $38 million state-of-the-art ER, and yeah, we're the hospital of choice for the EMS guys, the volunteer firemen, the volunteer ambulance, as well as the police EAB, Emergency Ambulance Bureau. Love that hospital. And why do they like it? They like it because that's the hospital of their choice. They know that the good care that they provide is going to be continued in that hospital, that people that they bring there, that their patients are going to receive good care. So the ambulances love us, the heliports are there. We have 2 heliports to receive patients from the helicopters, and really a great emergency department. So today we brought in one of what I think is one of the best doctors that I've been doing emergency medicine for 20 years myself, and one of the best ER doctors that I've ever come across, who works full-time in the ER. I wish I can get him there 24/7, but unfortunately he has a life. But he is in the ER a lot. He is really, the EMS guys love him. He gives a lot of lectures and continuing medical education to the paramedics and the EMS firemen and that type of stuff in the community in Nassau County. So Dr. Jet, Jet Singh, how are you? How's everything? And thank you very much for being here on
Thank you for
inviting
me.
Yeah. So why don't we start out by telling us a little bit about yourself, where you're trained, and what you're doing.
Well, I'm originally from India, did my medical school in India, and then in the early 90s came to the US, did my residency in both internal medicine and emergency medicine at St. Luke's Roseville Hospital, Columbia Health System in the city. And then about 6 or 7 years ago, I moved to the island. Was looking for a place to settle in the suburbs. Came around to Hicksville, bought my house, and actually the story begins there. The people who sold me the house, an old couple, who I talked to, them about me joining NASA University Medical Center. And right away, the couple gave me a big hug. And I wasn't sure what really happened. And he told me about 5 or 10 years ago, he was in a car accident on the island, and Nassau County actually saved his life. So right from the get-go, I knew this was the place I wanted to be in. It's part of my community. I live in Hicksville, and I owe this to my community to serve them. And so I'm at the medical center now.
Yeah. And listen, I mean, I know for a fact that, if there's a gunshot or a trauma or a car accident or a heart attack, you're the guy you want to see waiting when those doors open, because you're highly trained, you're highly motivated, you know your medicine, and your hands are good. You could do all those technical skills that need to be done. And it's, I talk about you in the singular, but I think Dr. Booten, who's the chairman of emergency medicine, who runs the ER, has put together an entire team of doctors like yourself. I mean, every doctor there, I really feel is top quality docs. And I'm an ER doc myself, and I've run a few ERs during my day. And I love, as you know, I'm probably more of a pain in the neck than anybody, because I'm an old ER doc hanging around the ER as often as I can, because I miss the adrenaline, I miss to see what's going on down there. So I'm down there a lot, and I see what you guys do. That ER is beautiful. It really
Yes,
is.
it's actually, the state-of-the-art ER on Long Island, I think one of the biggest. I think we have about 33 rooms, including 2 trauma bays and 2 resuscitation rooms. It is one of the biggest, I think, and actually one of the most beautiful ones I've seen on the island. We're a level 1 trauma center. Trauma meaning we take care of, there are 2 kinds of trauma, blunt and penetrating trauma. Blunt would include, car accidents, falling off trees, roofs, or getting assaulted, getting injured on the field. Penetrating trauma would be something like gunshot wounds or being stabbed. So we take care of the entire gamut of traumas. We have a level 1 trauma team. We have the surgeons on board. We're also a stroke center for New York State designated stroke center with a Gold Plus award for taking care of stroke patients. Besides that, we have a dedicated pediatric emergency room. We have board certified pediatrics trained physicians 24/7 who are taking care of all emergencies related to the pediatric population.
So you just said a mouthful. You just said a whole bunch of things that, I mean, we can go off and talk a half hour on each one of those things, never mind. So you start off with the level 1 trauma. So you're a level 1 trauma, meaning that, God forbid, this car accident or a fractured leg or sports injury, we have specialists. So it's not like a doc in a box, one of these urgent care centers where you see a doctor or a PA or a nurse practitioner. When you come into your emergency room, if there's an orthopedic emergency, you have a whole orthopedic team there.
Exactly.
If there's a neurosurgical emergency, a head injury, you have a neurosurgeon there.
Exactly.
If it's someone who's got a laceration to the face or a woman whose leg is cut, you can get a plastic surgeon there. And these people are in the hospital 24 hours a day waiting to see these specialists. Children, you come in with a child who's ill. Again, you're going to see a pediatrician.
Exactly.
In that emergency room 24 hours a day, 7 days a week. People say, okay, why would I want to go to I'll go to the doc in a box at the supermarket. Why would I want to go to the emergency room and wait 6 hours? Is there any waiting like that going on? I mean, how's the flow in that?
I mean, ER is an unpredictable place, as we all know. But, compared to an urgent care or doc in the box kind of place, we deal with all kind of emergencies, from a minor emergency to a full-blown critical patient. So we cover the entire gamut of, all kind of pediatric medical issues. So this concept of waiting in the ER, again, it's a relative concept, but the throughput is actually very fast. And we have a pediatric inpatient unit, we have a pediatric ICU, we have a neonatal ICU, we have a pediatric residency, we have residents, and I think for pediatrics, you can beat this place on the island.
So, exactly. So, I mean, if you're concerned if that person is really, look, primary care doctors have their place and they need to treat the patients as they should. And these urgent care centers really are everywhere now. I mean, they're coming up on, all over the place. And they serve their purpose. And look, they're great. But for real medicine, if something's really going on, you want to be in that ER. And I know Dr. Booten has a model of nobody in the waiting room. So,
yes, he's actually very aggressive about getting patients in from the waiting room into the ER, so they're within sight of the physicians, and the process can start taking off.
It's really quick. So you come in, you have a sick kid, you see the triage nurse in the front, and you go right into a room in the back.
Exactly, and you know the nurses are already on top of the case, and the physician has already eyeballed and started the flow process, and that's the whole idea, because kids can be a delicate population, and you don't want them to sit around in the waiting room, just totally lost there, and so we try to get them in early, and speed their care and delivery in the ER.
And yeah, so I know he says he wants them right in. How about we have a fast track? So people with earaches, sore throats, small cuts and abrasions, they don't even have to go into the main ER. They go to that separate area, which has a physician or a PA, and they see the patient very rapidly, called a fast track.
Right, as the name suggests, fast track means you have a minor complaint, and we can quickly get you through the process in a fast and expedited way. And so you're not with the main ER, which is all the critical care patients. And this way, for minor emergencies, we can get you quickly through, and you can be on your way home and to your work if it's during the daytime, so you can have a life, right?
And you have like operating rooms, right? In the ER, you have 2 resuscitation rooms, and you have 2 trauma bays. You have, you really can handle anything that comes in that door.
Yes, so the ER actually is, we have 33 regular beds, which actually are fully equipped with all the state-of-the-art monitors and equipment to monitor patients.
They even have TVs in those rooms.
Yes,
right?
they actually
and
have
they're not
televisions.
A curtain, they're actual rooms. So the way you built that ER, you guys, when you designed the new ERs, you actually made 33 rooms.
Individual rooms giving each patient their own privacy and space for the family to sit down and be a support system during their critical time. So these are the 33 regular rooms. And then you move on to what's called the resuscitation room for patients who are very critical or come in cardiac arrest, where we resuscitate the sick and critically injured folks. Besides that, we have a trauma bay, which has 2 trauma beds with all the equipment that's needed for anybody who's involved in a traumatic emergency. So those are state-of-the-art also.
So we were also, in addition to a trauma center, also a stroke center. And we also received a Gold Heart Award for the American Heart Association for cardiac. And for GYN, we just received 5 stars,
5 stars,
for
right,
GYN
right.
surgery. I mean, every time every day I go to work, there's another award coming down. The Leapfrog, which is one of the top nationwide surveys, just gave us an A rating for patient safety. One of the few hospitals in Long Island, and let me tell you, there's some fierce competition in Long Island. There's some great hospitals in Long Island. We're very blessed here on Long Island to have so many great hospitals. But put us in that mix, and to receive an A over some of those good hospitals is really amazing from that Leapfrog survey. So we have a lot of great things at this hospital. You have a CAT scan in the ER. What's the 320 slice CT?
Yes, it's actually one of the state-of-the-art CAT scan machines in the country, actually. And we have the CAT scan literally walking distance from the ER. So patients can come in through the EMS door, be resuscitated in the critical beds, and taken to CAT scan. I could literally walk with them and monitor them while they're getting their CAT scan or X-rays. And I think that ability to be with the patient during their critical time, speed up the imaging studies, and have this, the best machine on the planet. So
that CAT scan is so sensitive. It could actually take pictures of your coronary arteries while your heart is beating.
Exactly, right. That's the new technology. It's called CT coronography, where you can actually assess people with chest pains. In fact, my wife, she's a CT tech, and she seems to be so jealous about our machine because they don't have that kind. So she was really impressed with the machine.
So people come to us with chest pain.
Yes.
So they think they're having a heart attack. We do the EKG and the blood tests.
Right.
We can actually put them on the CAT scan
Right.
and take a look at their coronary arteries
Exactly.
in the emergency room.
Exactly. You can look at the flow, if there's a blockage anywhere in the blood vessels supplying the heart. And I think that's the new frontier of medicine.
I mean, some way we're not saying it or suggesting in any way this replaces coronary angiography or getting in, and doing, some invasive procedures, in the cath lab. But for our screening, for us, for our purpose in emergency medicine, it's cutting edge technology, and there's still a lot of research to be done in that area. But it's in the ER proper. When you guys designed the ER, you designed 2 CAT scan rooms.
Right.
You have X-ray in the ER. And you have a sonogram machine in the ER. So you have
Right.
all the radiological equipment in that emergency department proper right there for them without having to travel to another area of the hospital.
Yes, that's actually a big plus at the medical center because having x-rays, which is what you use for looking for fractures and pneumonia, we have the ultrasound looking for a pregnant patient who comes in with a medical emergency, and then having the CAT scan right next to us. And I think it's the safety factor that's built in, that I'm within walking distance, and God forbid, patient deteriorates, I'm always there. I'm right next to them.
So you have a stroke, or you feel weakness in your arm, or your vision is blurry, something you think you're having some neurological problem, a CVA, a cerebral vascular event.
Right.
You come to the hospital, EMS picks you up, the emergency medical service, the firemen, whatever, and they call us. We have a guy coming in with a potential stroke. What do you guys do to prepare for this guy, coming in?
So let me run you through what really happens. As some of you may or may not know, Nassau County Medical Center controls the entire Nassau County Ambulance Bureau. So we have a red emergency phone line in the hospital. If an ambulance picks up a patient with any emergency, whether it's a trauma or a stroke, they call ahead of time. And as an ER physician on my shift, I'm in charge of that. I would pick up the red phone, take the report from the EMS, and let's say, for example, they said, we have a stroke patient coming in. I activate the stroke team, which gets the CAT scan people ready, the laboratory personnel ready, we have the bed ready, the nurses are ready to go. Stroke patient rolls in with the EMS, we assess them by the bedside, and right away we rush them to the CAT scan. And this is all a time-based disease process. And within minutes, we have the results of the CAT scan read by some of the finest radiologists we have. And as soon as the CAT scan results are back, we can decide on giving them blood thinning medications versus taking them to surgery if they have a bleed in the brain. So that throughput process where EMS being a lifeline on the field, calling us ahead of time, and we are prepared, I think that's where it puts us over the edge and gives us the Gold Plus award that I think we really have that.
Yeah, and it really is something, the patients in Nassau County should know, that we have a system for heart attacks, strokes, trauma, that we are notified ahead of time, and that by the time that ambulance hits that door, the CAT scan table is clear. The neurologist is in the ER. The
Right.
neurosurgeon is on standby.
Right.
You have a special neuroradiologist that reads brain CTs, ready to read that X-ray, that CAT scan. And you guys are waiting in the resuscitation room for this person. So anything to save his life or prevent him from having any further disabilities, anything we could possibly do is
Right.
already being done.
Yes, and actually it starts right in the field because I not only work in the ER, I'm actually the clinical instructor for the Nassau County EMS Bureau and the EMS personnel. So a part of my education is to help them identify stroke patients in the field. So we're all a big teamwork where EMS picks up patients from their homes, calls us ahead of time. We are ready in the ER, and then we give them a feedback, how they performed, and I monitor their education. So it's a big conglomerate for teamwork, all for patient care.
Yeah, I mean, it is great. And so emergency medicine now is changing and it's evolving. And so I understand now we're going to open up a residency July 1st.
Yes, actually, that's something I'm looking forward to because I'm going to be one of the clinical instructors for the residency program. As of now, we have residents from the North Shore Long Island Jewish Health System. They rotate at the medical center, I think, an average of 3 to 4 residents per month. So we teach them, we supervise them, and make them, to be future ER docs. The new thing that's at the medical center, as of July 1st, we're getting a new residency program. So really excited about that, and that'll help us to spread the word and educate more residents and future ER physicians for the country.
And and we're very proud of that collaboration with North Shore. North Shore Long Island Jewish Hospital System is one of the finest systems I would think in the country,
Right.
and they really have a huge amount of resources that they bring to Nassau County, and we're very proud to partner with them in a lot of these different areas. And and we will continue to be with them as far as the emergency medicine, but opening up our own residency gives us additional training capabilities. They give us additional funding. It really is a good program overall for the emergency department. And it's good to have extra doctors on hand as well. So it's
Plus,
really bring some of the life in.
Dr. Politi, as you know, overall nationwide, not all emergency rooms are staffed by ER trained physicians. So these new students and residents who would be starting, they are the future for emergency medicine in this country. And I think I'm very proud that I would be starting this program with these new residents and guiding them in the future.
So we have a separate emergency department area, or separate area in the emergency department just for peds. It's separated by some nice glass doors. It's a separate area over to the side. And Dr. Kristen Kumar, well, I actually had Dr. Kumar on the show once talking about pediatric emergency medicine here, is in charge of that area. So how do you guys work together with the peds emergency room?
Well, pediatric ER is staffed by pediatric board certified physicians. The ER is divided into the adult and pediatric part, and anybody under the age of 18 qualifies as a pediatric patient. So they are screened to the pediatric ER, and they have pediatric residents in training, supervised by pediatric attendings who monitor and take care of their medical issues. And if they need to be admitted, we have a dedicated pediatric floor up on the hospital. And if they are more critical, we have a dedicated pediatric ICU to monitor sick babies, sick kids.
Yeah, it's got everything that you might need. So now I'm a person, I'm listening to this radio show. I certainly don't want to get sick or injured, but God forbid something happens. What should I have prepared when I come to the emergency room? Should I have my medications written down? What do you suggest I have waiting for you? Or when I walk in or I give to the ambulance, what would you like to see?
Well, the most important as a ER physician, what I would like to know about any patient is their medical history, as to what medical problems they have and what medications they take, and if they have the name of their primary doctor, because that helps me to get in touch with their primary doc and kind of coordinate the care for them. So I think that's the most important thing one can bring to the emergency room. Rest assured, once you get to the ER, you're in good hands.
So it's important that everyone should write it on a piece of paper and keep in their wallet or their pocketbook. Some medical history. I have asthma and diabetes and hypertension, and I take albuterol and insulin and Vasotec.
Right.
And my doctor's name is Dr. Victor Politi with his phone number,
Right.
so that when he comes in to see you, when the patient comes to see Dr. Singh, and you see that paper, you could immediately say, all right, we know he has hypertension, let's do this, this, and this, and let me call Dr. Politi so he knows that his patient is in the emergency room.
Exactly, because that makes life easy for me as a physician on this end. And now, I guess we should use technology to our advantage. With all the smartphones, you just have to take a picture of your medications. You can write them on an index card, take a picture, and you've saved it for eternity. And this way, you don't have to carry anything, and it's always with you. And I always tell family members, share the wealth, as I say it. Make sure all family members have a copy of that record. And it just makes it easy and safe, I think, for the patients.
I remember, when I was practicing, I used to tell patients to make a copy of their EKG and keep an EKG in the pack. You just said a great thing. Take a picture.
Picture, right.
Next time you go to your doctor and they have a cardiogram,
Right.
Take a picture of that EKG, keep it on your phone so you can compare the old EKG
From the
to the new EKG.
Right. Pictures, they say pictures speak 1,000 words.
Good idea.
And we should use technology to our advantage. And, I'm known for, teaching my patients about how to be part of the health. I'm a physician, but they need to be active participants. And it starts from very basic things like knowing what you have and what you take at home. And a lot of people, do not do that. So I think it's a good point.
You may come in unconscious, God forbid, from a car accident, or you may, be something, your sugar is dropped and you're lethargic, and so, people may not know you, and you have this stuff written down, and it really gives us an idea of which direction to go in.
Exactly, right, because you have somebody who passes out on the street, and no one has any clue, are they diabetic, is their sugar low, sugar high, or they've had a seizure. Having that on the phone or on them, in their wallet or in their pocketbook, I think really can help me do a better job.
So everybody's having really horrible sinusitis right now. The allergies are out there. There's pollen, sinus headaches, and nose is dripping. What should everybody be doing now? I'm sure your ER is packed with people with these complaints.
Well, the first thing is, seeing their allergist or their primary doc and figuring out what really are they allergic to. I mean, there's pollen, there's roaches, there's dust mites, there's food, there's chemicals in the air. So that's the first step. After that, once you come to the emergency room, we have the usual cocktail of medicines, which is, Benadryl, Pepcid, sometimes steroid inhalers. The treatment factor is the same. It's knowing what you're allergic to so you can avoid a future attack. And as a ER doc, again, I think of the worst stuff that can happen to any patient. And the worst thing is what's called anaphylaxis, where they stop breathing or their tongue and lips and mouth start to swell up, and which can actually lead you to respiratory arrest and death. And for that, we have what's called the EpiPen, which is a life-saving injection which you inject into your upper thigh. So I think all people with asthma or allergies should have that in their pocketbook or in them. They should never leave home without an EpiPen. And the word doctor in Latin means to teach. It has nothing. It has to do with healing, but it's more about teaching. And a big role of mine in the ER is to teach them to take care of themselves and how to prepare for an emergency. God forbid, an emergency does happen, I'm always there to take care. But if we can avoid, the dire straits and they're going to the hospital, I think that's the best we can do.
So you're saying, so right now people are pretty much allergic to the pollen that's in the air or whatever happens to be, and they're all congested. So basically they should, if they could avoid it, fine. But guess what? You can't. I can't move to Phoenix.
Right.
So I'm stuck here in Long Island right now, and my allergies are killing me. So for my nasal congestion, I have a lot of over-the-counter stuff. These antihistamines, non-sedating antihistamines
Right.
that people can take. Different types. And I don't want to mention some of the names, but we all know what they are. You just turn on the TV. There's 14 commercials for them. And if it's something a little worse, they can have the nasal sprays.
Right.
And there's some that have steroids in the spray to help shrink some of those things as
Right.
well. And usually that takes care of it, right? And if you have headaches or something, you just take regular Tylenol or Motrin or something for those headaches.
Right. So what you mentioned all the medications that one can take for sinusitis, but be careful because a lot of these medications have drug interactions with your let's say your blood pressure medications or your diabetic medications. They can raise your blood pressure. They can make you drowsy. So before you kind of take any medications over the counter, I always recommend discussing with your primary doctor, lest you have a bad drug interaction, because those sometimes can be fatal too.
And so what you mentioned was anaphylaxis, and these people have that really bad reaction to a bee sting or some sort of allergic
Peanuts,
or something.
right.
And in those cases, the EpiPen is definitely life-saving, and that's something that you can also get from your primary care doc as well.
Right.
So there's so many things that you guys see every day, whether it's the common cold, the earaches, sore throats, the routine stuff that you handle like champs, or some things that are a little more technical, really bad lacerations that you guys need to clean up those wounds and suture them, or a large boil or an abscess that you need to incision and drain it, get the pus out, and put them on some antibiotics. So every day you're seeing all these routine things, and that's bread and butter emergency medicine. And
Right.
then speckle that with some really moments of terror, might you say, or complete adrenaline discharge, where you'll see the gunshots and your stab wounds. Would you say that sort of rounds out your normal day, Dr. Singh?
Yep, that's a typical day in the ER, and ER, again, it's an unpredictable place. Anything can walk in through the ER any time of the day or night, and that's the excitement about it. Fixing and helping people within a few hours. I'm making them turn around, making them better, and actually many a times bring them back from the jaws of death.
Yeah. And I mean, I'm an ER, and anybody out there that's thinking about a career in medicine, it really is so worth it. You have two doctors that have been doing this for so many years and still have a love to working in that emergency room, to treating these patients and to being involved in these patients' lives. And it really is great. And there's a lot of careers out there. If you don't want to be a physician, there's nurse practitioners, there's physician's assistants, there's X-ray techs, there's physical therapists. Healthcare today, I mean, is such a great field, and really, really recommend you guys do it. And we do have a lot of students and volunteers. A lot of volunteers from college, people that want to be pre-med, they come to the hospital.
Exactly, that's a point, a good point you mentioned. Not only do we have residents in emergency medicine, we have medical students from NICOM Medical School and the Caribbean schools. We have PA students, EMS students, and we have volunteers from local high school, who come in to volunteer too. So we give them education and share with them.
It's a great career. So. Well, Dr. Singh, it really was great getting a little look into the emergency room and see what's going on over there in Nassau University Medical Center, and the fact that we know we have great doctors like yourself there to take care of our citizens and our residents in Nassau County. You know, keep up the good work, and God bless you and all the docs and nurses that are in there, and those nurses really are the best. The ER nurses are, and I know you'll agree with me, they're the top of all nurses. Anyway, I just want to say thank you to everyone for listening today. Thank you for tuning in to WHLI today on the radio. I know it's Saturday morning, and you guys are going to be very active running around doing your gardening and all the other stuff that we do out here on Long Island, going to the beach and boats, and just be careful because, you know, everything we do, you know, always have your eye out for an injury. Always look out for what, you know, make sure you're sitting on the right side of the branch when you cut it. You don't want to be sitting on the wrong side, get hit in the head with a tree trunk. And be careful crossing the street and all other cool things. So, but God forbid something happens, we're here for you.
Yes.
And feel safe knowing that you have the best of the best right here at Nassau University Medical Center waiting here 24 hours a day, 7 days a week. Again, I'm Dr. Victor Politi. I want to thank you so much for listening today. You know, stay healthy, and if you need us, we're here for you. Have a great day.